JKW Kekal and Putrajaya Research Day. My name is Jacelyn. It is my honor to be your MC for today. As you know, the theme for our Research Day is the AI Revolution, Unlocking New Frontiers in Research. We will be starting off this year's Research Day with our very first session titled Visual Abstract. We are truly blessed to have Dr. Tong Voon as our speaker for the first session. As many of you are aware, Dr. Tong is a consultant endocrinologist at Hospital Putrajaya with over 2 decades of experience, even though it doesn't show that she has 2 decades of experience because she's so young, in my opinion. She obtained her MD from UKM and became a member of the Royal College of Physicians in 2009, later completing her fellowship in endocrinology in 2015. She was conferred Fellowship of the Royal College of Physicians in 2020, 5 years ago. Dr. Tong has served in major tertiary hospitals across Malaysia with notable contributions in clinical service, research, and medical education. Her research spans diabetes, thyroid disease, adrenal disorders, and metabolic conditions with numerous publications in international peer-reviewed journals. She's actively involved in National Clinical Practice Guidelines, CPGs, and Health Technology Assessments, HTAs. She also serves as a PACES examiner and has also organized numerous endocrine workshops throughout her years. Without further ado, I would like to invite Dr. Tong Voon, endocrinologist, to deliver her session titled Visual Abstract. Let's give her a round of applause.
Good morning, everyone. It's so fresh to see so many people here so early to learn about research. So since our theme this year is AI related, so I want to declare that when Jacelyn asked me for a short biography, instead of writing it myself, I decided to ask my new friend ChatGPT to summarize my CV and came up with the short biography. So yeah, that's one thing I learned before even the workshop starts. So today I was asked to talk about visual abstract. Before I start, how many of us have never heard of visual abstract? Never heard of it? Yeah, so quite a number, right? So those of you who have heard of it can go and lepak outside and come back after my session, right? So, okay, so I want to ask you a question, another question, and Jacelyn said to ask the people at the last row, kan? But it's okay. I'm very kind. I'll just open it to everyone. Which do you think is easier to read? Doctor Strange, yes, I agree, right? So the ones with the graphical, representation are so much easier to read. I don't know whether people read text books anymore like that. It looks so plain in comparison, right? Okay. Besides visual abstract, you also have things called, visual novel. I'm sure we all grow up reading visual novel. And there's also such thing called a visual poem, right? This is something I also learned when I was preparing for this talk. So the use of visual to summarize articles actually is nothing too new, all right? It's got a long history, and there are many examples dating way back in 1980s. But really the first visual abstract that was, was showcased in social media was only in 2016, so about almost 10 years ago. And why visual? Because visual helps us interpret information, complicated and complex information, more easily and more quickly than text alone, all right? And presenting information in a visual or graphical manner decrease the cognitive load. Okay, let our brain rest a bit, not so much energy required to interpret the information, right? So there are some very classic old examples, like John Snow's epidemiological map of London cholera outbreak. And do you know that Florence Nightingale also used some sort of graphical or diagram representation when she wanted to look at causes of death at the war area? So I found this very interesting, right? This is what Florence Nightingale came up with, to try and investigate or analyze the causes of death in the army area, right? So she used, if you can see, I'm not sure whether you can see from the back, she used this circle, this round graph, and it's divided into different months of the year. And she used different color, right? Blue color is represent communicable disease, whereas the one in pink or red is death from wounds, right? In war, right? So a lot of wounds. And the one in black is others. So then with this graph, you can tell, certain months like January, February, March, probably the winter months, you get more death from the communicable diseases. So this makes things very easy to see, right? And just to let you all know, the first visual abstract that was shared in Twitter was this one by Annals of Surgery in 2016. And it is about how a coordinated trauma system, after being established, improved survival and increased the involvement of specialists and senior clinicians. Right? So one look at it, it tells you, it gives you a lot of information. So, all right, definition, a bit of definition now. What exactly is a visual abstract? So I've mentioned in a few slides, but there are some definition that has been put forward. It is basically a visual summary of the article's main findings, right? So in this visual summary, there is information contained within it. It must contain methodology and important outcomes from the study that you are trying to portray. So in a way, it's like a movie trailer, right? When you're on your Netflix, you don't know what to watch, you look at the trailer kan. So the trailer tells you interesting or important aspect of that, whatever series or movie you want to watch, and then you decide from there whether you want to continue watching, right? So in a way, a visual abstract is a movie trailer for actual abstract. So then you might come across this other term, graphical abstract. So graphical abstract is a piece of artwork that is intended also to summarize the main findings in the article. So this is the abang of visual abstract, the older term, and there's some slight differences, but it represents the same thing. So I told you what visual abstract is. I'm going to share with you what visual abstract is not, all right? It is not a substitute for reading the whole article. I know it's easy to read, it's easy to understand, but you cannot declare that you've read the article if you just look at the visual abstract, right? And because it does not contain all the details, and finally, it should not influence you to make, clinical decision just based on it alone. So you need to go and read the actual paper if you're interested in it, right? It's just an introduction, but you cannot, this visual abstract says that by using drug A, I can reduce the mortality in disease B. So I'm going to use drug A for every single patient that I see that come to me with disease B. So that should not be the way. Okay, so if you look at this visual abstract, does it attract your attention? Yes? No? Don't know? Fall asleep already? Yes, only Jaslyn answering me. But she said the person at the back should be answering, right? That's fine. So this is a visual abstract by JAMA. So basically they wanted to look, so it's very easy when you look at it, that's the important theme at the top. Does vitamin D, activated vitamin D, reduce CV risk in patients with HD? And then they have the methods there, followed by what was the intervention and what was the outcome. And you have to use visual icons in visual abstract. So for mortality, they put a tombstone there, right? So, and at the bottom usually is the conclusion lah. And the conclusion is in this study is if the patients on HD without secondary hyperparathyroidism, if you use the activated vitamin D, it does not reduce CV risk. All right. Of course, this doesn't mean you see this visual abstract, then you're going to stop all the activated vitamin D in all your patients on HD. No lah, you have to go and read this paper to see whether there's any limitation, any caveat before you make that kind of clinical decision. This is another interesting one that I came across, which was prepared by JFAS. JFAS is our favorite endocrine regional journal. Okay? So I find it interesting because I've never checked my patients' PP, not never, I don't routinely, okay, the word is not routinely check patients' PP left or right. Any of you all do that? Every time the patient come to clinic, check kiri, check kanan, check atas, check bawah? Okay lah, tak ada atas, tak ada bawah lah. Do you all do that? Because I don't. But interestingly, it's been found that if there is an inter-arm difference in the BP, it is associated with increased cardiovascular risk lah. So this paper, I think this was, if I'm not mistaken, a Singapore paper. So they look at differences of inter-arm systolic BP among Chinese, Malays, and Indian patients, right? Of course, you cannot say that definitely the one with the highest difference have the highest, will have a cardiovascular disease. But, you know, it's interesting, something interesting for us to think about. And if you have if you do not have a research question and looking for one, is potentially something that you can delve into. So next I go into, right, why want to create visual abstract? Why want to sebo do extra work? Any idea? Okay, so these are some of the reasons. Number one is for yourself, right? It is for you, let's say you have done a study, you have completed, and you want to produce something so that you can share your work in an easier to understand, memorable way. All right, and then you can, if you share it in, for example, in social media, you can watch how people interact and, you know, discuss your findings, so on and so forth. So number one is for yourself. Right. For example, this is another, I'm going to show a lot of examples of visual abstracts that I found interesting along the way when I did these slides. So this is another example from NEJM. We all know NEJM, right? NEJM is, I think, the highest, the medical journal with the highest impact factor. So if you go to NEJM website, you will see that they are using visual abstract a lot, right? And this is one on managing coronary disease in patients with advanced kidney disease, whether invasive strategy or conservative management give a different outcome. And they found that invasive treatment did not. So if you are interested, after looking at this nice picture, you can go and download the paper and read it. And the other one is for your community or for public, right? So you can use it to highlight articles from journal and to draw attention to online journal clubs. Oh, sorry, my mistake. For your community, it's your medical community, all right? So for, let's say, Jaslyn have done research and she's written, you know, she has managed to publish her research, and now she wants to share with the rest of us. So she can use a visual abstract to highlight the paper that she has published and maybe share with us in one of the journal clubs that we have, right? That's an example. And the final one is for public, right? If you have important message to reach out to public, you can use it. But of course, if you show public, you know, that visual abstract that I showed you earlier on, they might not understand or it might not catch their interest. So let me illustrate. So if you want to use a visual abstract for public, you have to use it, you have to use a more layman way to reach out to them. All right. So just share with you an example on how you can reach out to public. So this is a Malaysian study done by our pediatric team. So in this study, they are looking at different causes of congenital hypothyroidism among Malaysian children. So this is their main outcomes from the study that they have done now, right? So there are different causes: thyroid dysgenesis, dyshomogenesis, transient hypothyroidism. So they have shown very clearly in this visual abstract, in each condition, what is the gender preponderance, what is the mean TSH, and what's the prevalence, right? So if you show this to your, say, when you're giving a talk to public about thyroid disease, do you think they will understand? Yes or no? I'm just testing if you all have fallen asleep. Still quite early, not 9 o'clock yet. Probably they might understand the male and female part, but the rest of it might not be so easy to understand. So then this is another version of a visual abstract of the same study, but this is for the public. Again, you see causes and consequence of hypothyroid in newborns, right? So instead of using the medical term, no battery, Can hear, all right. Absent thyroid, right? And in absent thyroid, out of 5 babies, 2 babies may get it. Okay, my mic had severe hypothyroidism and decided not to work. But thank you, Jesslyn, for saving me, right? And so, and then for the consequences, they have shown there, nervous system and developmental delay, right? So I think if you show this to public, probably a bit easier for them to understand. Okay? Any questions so far? Sorry, do some adjusting. So we try to make this session relax, so you can, if you can't hear me, you can raise your hand. If you don't agree with what I say, you also can raise your hand, but don't shout, Just tell me you don't agree. Okay, no question, we shall move on. So visual abstract has been shown to increase dissemination of the information, right? So there's a very interesting study, again done by this surgical journal, to compare the outcome when you use visual abstract versus when you don't, right? So basically, this journal, this group of authors did a study on visual abstract, right? So what they do is they did a crossover study. Then I'll show you the graph. What they did was they divide the original research into 2, and half of it, they only tweet the title, and the other half, they tweet the title plus the visual abstract. Then after a washout of 4 weeks, they cross over. And as for outcomes, they assess the impressions, the retweet, and article visits, okay? And what they found is a lot of numbers here, but the conclusion was that if you only tweet the title compared to those you tweet the title plus the visual abstract, those with visual abstract had 7 times more impressions, 8 times higher retweets, and 3-fold higher article visits, right, on the publisher's website. Right, so what it shows, it does attract more attention. So then they have this visual abstract on the visual abstract study, right? The same thing that the study I showed you. So if, very clearly in this visual abstract, you see that, with the use of visual abstract, there's increased impression, retweets, and article visits. Right. You probably have already seen visual abstract. Some of you said, you put up your hands when I asked whether you've heard of it. You said no, but I have a feeling most of us would have seen it someplace or another. For example, in BMJ, they also have a part on visual abstracts. And there are certain journals that actually compel you when you submit a paper for publication, they actually make visual abstract compulsory to submit together. So these are some of the interesting visual abstract from the BMJ, right? So the first one, very interesting, they look at use of Tai Chi for fibromyalgia, right? And I won't bore you with the details, but what they found was there's a reduce in the symptom scores in the patients who actually practiced Tai Chi versus those who didn't. And the other interesting one is they look at wearing surgical face masks in public spaces, whether it reduces your upper respiratory tract infection. So yeah, as expected, those people who regularly wear face masks had less self-reported symptoms, right? So look at the way they arrange the icons, the graph, the images, as well as how they portray the methods and the outcomes. It does make you want to go and read, right? I don't know, for me, I wanted to go and read the Tai Chi paper. Right, and these are some of the visual abstract that you may find in NEJM. So NEJM, I think, have a lot of very artistic people working in there. So they have very nice, very colorful visual abstract. So this is one on use of azithromycin for mass use to reduce yaws eradication. So when I look at this, I say, oh, yaws, very familiar medical school time, macam got here before. Have you all heard? Do you remember? Do you remember what organism caused it? So when I read this, I went and Googled, Treponema pallidum. Pernah dengar kan? Cuma so long ago, right? So they found that when you give in mass 3 rounds of azithromycin in these areas in Papua New Guinea, which is endemic area, you reduce the prevalence of active and latent disease. And then for those of you who are from the surgical side or maybe anesthesia, this is one that look at spinal versus general anesthesia for hip surgery. See, so very nicely portrayed there, the hip fracture, the spinal anesthesia, general anesthesia, and they found that spinal anesthesia was not superior to GA. Again, I caution you, it doesn't mean after this then you decide not to do spinal anesthesia. You have to go and read the paper and see whether the actual study and all makes sense, whether it's something that will change our clinical practice. Right, so just to share, some of the other visual abstract from other famous journals such as JAMA. So JAMA have a lot, JAMA Medicine, JAMA Surgery, JAMA Peds. So they also use visual abstract to highlight their papers. And nearer to us, of course, from the JFES, Journal of ASEAN Federation of Endocrine Society. So this is our go-to journal. And they also are very active in using visual abstract to highlight their papers. So in fact, where I learned visual abstract from was from JFES. They had a workshop. It was during COVID time. They had a virtual workshop for us to teach us and introduce us to visual abstract. So this one is, it's something that I would be interested, factors associated with outcomes of pheochromocytoma in India, right? And another one, the effects of excess iodine in the mother on neonatal thyroid function. So they found that no effect of neonatal growth after 3 months. And see, it's quite cute, right, how they use the gambar of different stages of babies to portray the fact that there is no effect on the development of the babies. So my next question to you all, are you ready to create your own visual abstract? Yes, belum ajar sudah ready, bagus, okay. So I will share with you steps in creating visual abstract. This is the subsequent few slides are courtesy of Dr. C, who's an endocrine colleague of mine. Right. So before I start, these are the important components that you need to have in an effective visual abstract, right? So you need to, usually at the top, summarize the key question or the topic, right? And then you need to have a summary of the outcomes. And what are the outcomes? And then you need to put in visual, right? Visual display. I always find that very difficult because I'm not artistic. That's why I use Dr. C's slides to show you how to make a visual abstract. And then the data needs to come with unit. And at the bottom, you need to put who's the author and who created the visual abstract. Okay, simple enough, right? Right. So what are the things you need to do before you start creating your visual abstract? Number one is choose your article. It can be an article that you have written, a study that you have done, or it can be any article in the literature that interests you. And then the aim is to highlight important points that can influence or impact readers. Number three is it's easier said than done. Don't be stressed. Because during the visual abstract workshop that I attended, we had to actually do the visual abstract and then share it with the rest of the attendees. And actually I was quite stressed because, as I say, I'm not very good with art. I don't know which color and which color looks nice, because what looks nice to me generally don't look nice to other people, so on and so forth. But try not to be stressed. And actually anyone can do it, right? So step one, you select your article. Step two, then you select what is the key message. Important thing is some papers have a lot of message, but you do not want to overcrowd. Choose the important ones and keep it simple. So we decided to choose this article, tirzepatide once weekly for treatment of obesity. And if you see here, this is the actual abstract of the paper. Now we're going to do the visual abstract step by step. Next step is you create the fields, the visual field. And you use program that you're familiar. It can be, I know all of you very pandai Canva, right? But I'm not so pandai, I'm very old school. I still use PowerPoint, which is fine. And then, I'm sure there are a lot of new programs out there that you can use, but use one that you are familiar with. So these are the visual fields, right? There are actually many ways that you can arrange the visual field. Later I'll show you a few examples, but this is the simplest way to do it. Then you add the author, the journal, and the title, and fill in some essential information and the details about the person who did the visual abstract. Okay, so as you can see, Dr. C has put his name there and his contact and the article's information and the title at the top, right? Benefits of weekly tirzepatide in obese patients. Next, you lay out your outcomes, because outcomes is one of the most important things, right, from the article. So what you want to do is describe the outcomes in short phrases, right? And for example, okay, so we have study population at the first column, and then in the middle column is the method, right? And the intervention that is being given, and then the outcome. Okay, so the study population, patients who are obese, what's the BMI, what's the age, and importantly, they have no diabetes. And the intervention is tirzepatide versus placebo, and there you have the duration for 72 weeks, a little more than a year. And the outcome they were looking at is weight loss, BP, and the LDL cholesterol. Okay, this is probably nicer to look at than reading the actual abstract, but still quite boring, right, because all words. So then you add in the values, right, for the outcome. And if you can, you add the p-value. Okay, so here he has put in the outcome. As you can see, the weight loss is reduction of 10 kilo, then reduction in systolic BP and LDL. And finally, second last step, you add the visuals, all right? So but you must be careful not to use images that you have no permission to use, right? So we see here, let's see what Dr. C chose. So for above 18, very, very clear, right? That circle 18 plus, no diabetes, obese, all right? And then tirzepatide versus placebo. Then for the weight loss, he put a weighing scale there. For the systolic BP, a heart, and LDL, a drop of blood, all right? So, I mean, I don't know about you, but compared to without all these visuals, it makes a lot of difference, makes it a lot more interesting. And then finally, you export your file to wherever you want to share. So these are some of the other ways you can arrange your visual field, right? So you can either go left to right, up to down, or you can even divide your outcomes into three, or two, or four, whatever. But usually, we don't want to overcrowd it. Usually, we stop at 3. So these are some of the, again, more examples of how, if you arrange it from left to right, if you arrange it from left to right on top, and if you arrange it up, down, right? Or if you divide your outcomes and show it in 3 different columns. These are some of the resources you can use to make your visual abstract, apart from Canva. So you can get some nice icons from Now Project, okay, flat icon. So this is the Now Project. So what I did was I try and search cute thyroid gland. Because just thyroid gland itself quite boring, right? So I put in cute. So these are the images that they show Not very cute also, but okay. I think probably we see and we know it's thyroid kan. Right? So in summary, these are the steps that I've mentioned. And before I end, if you are interested, this is a resource It's written by. It's prepared by this Dr. Andrew Ibrahim, who's one of the first few pioneers who, introduced and talk a lot about visual abstract. So that's the QR code if you're interested. This whole article on why we do visual abstract and how to do it step by step. Yeah, I think that's my last slide. Before I end, any questions? While you're thinking of a question, I just want to share a story. So I've actually given talks about visual abstract a few times, even among my endocrine colleagues. So most people not very interested about visual abstract until, one day they want to submit a paper. One of my friends wanted to submit a paper, and then the journal asked him to, you have to also submit a visual abstract for your paper. Then only come and ask us, hey, what's visual abstract, how you do it? So I think it is something extra, good to learn about, and it'll be very useful to, disseminate your research or article. Any question? Okay, maybe still early, everyone's still warming up. If no question, I thank you for listening to me, and I thank the organizer for